What's up, everyone? We're going to do a little day in the life, but this looks a little different. I'm in comfy clothes, so you're kind of wondering what's happening. First, I'm trying to, mix up my spots where I talk. This is my home. I feel very comfortable here. Couch, my two plants. There's more plants in the living room. I wish I could show you, but I don't have a cameraman, but that's for the future. What I want to talk to you today about is a day in the life of a sales rep, but this is a little bit different. This is a Sunday. And I try to have a really strong work-life balance and not have work on the weekends. In med device sales, it's very common to work outside of a typical 9 to 5 day. You're doing a lot of dinners. If a customer, a physician or a hospital ever calls me, I'm picking up. Typically after 5, if it's my own team just wanting to catch up or talk about something, I won't answer. I could do that during the workday. But if it's an emergency from a team or someone needs support, I will pick up. So medical devices, it's almost 24/7, especially depending on the division you're in, because there's potential that you could be taking call. But where I'm at now, I really want to have a balance and not just get focused on work. So I want to be honest. So Friday, we had a case in the morning. I get done midday. It was a beautiful day, sunny. The surf was pumping. So I wanted to get home. It's been a really long week. So I wanted to surf. I wanted to come home. I wanted to go play basketball. And then I wanted to come home and cook something really special on the Big Green Egg. And I have the ability to make that choice. I run my territory. I'm the sales rep. I need to hit my number. And that's what I wanted to do. I wanted to recharge for the next coming week. But typically on Fridays in the afternoon, I like to plan for the next week and visualize the quarter and the year and the success I'm going to have. So today's Sunday. I usually do this in my office with a journal, but it was a little dark, so here we are. But I want to talk about what kind of differentiates a sales rep from an account manager. And those words are interchangeable, and every company calls a sales rep or account manager or territory manager or something different. But I think what separates a really good sales rep from someone that really understands a long term and business partnership is doing forward thinking. So to me, a sales rep's in the OR is very good at flipping cases, articulating, solutions to the physicians and winning on the day-to-day battle, but can that last long term? And when I think of an account manager, I'm gonna walk you through this process, but I try to visualize an account and where I want to be in a quarter and a year. And what do I mean by that? That could be an account that I'm not broken into, and I want to visualize in a year where this partnership can be. And then I'll work backwards from a year to a quarter to what I need to be doing today or this week, right? It can be overwhelming when you get your sales number. You're trying to do everything in one week to get there, and that could hurt yourself. It could hurt relationships. You could, it could be a little not right. So when I take this long-term approach and work backwards, it makes it more digestible, and I understand what I need to do each week to get where I want to be. And I also think some people think this is crazy, but I think visualization is a really important thing where you could see your future self. So when you're there and on the work you need to do to get there, you've been on the path before, and that's through visualization. So account management, this is going to be what I do typically on a Friday outside of the administrative reports, the expense reports, and all that stuff. This is going to be more strategy and how I keep being successful quarter over quarter and change market share, have growth, and hit my goals from a year out. I'm a big believer. I think the quarter system in the United States, from reps to territories to the stock market, you really got. I don't think it's right. That's what I'm going to say. I think you need to have a long-term solution. What can the company or territory do long-term that's sustainable and hits the growth, right? So I'm going to walk through 2 examples of this visualization technique. The first is, I need to set the story. It's a little account. So let's say they're doing 100 of my product and they're familiar with us, but they're not too familiar. They do us maybe 1 out of 100, 5 out of 100. So let's say that's 5% market share typically each year. And the customers, there's 3 different customers that use us with all different kind of personalities. Some are a little bit more academic and some are a little bit more proceduralist, meaning they just want to get in and out. So what I want to do is I want to think about this account and where will our relationship and our partnership be in 1 year. And I close my eyes or I journal and I visualize that this partnership with the data that I have in my current role in a realistic but stretched expectation is going to be 25%. And I know what patients those are. In my mind, this hospital now is doing 25 cases a year with us. So that's 6-ish cases a quarter. So that's 1 or 2 cases a month. So I'm visualizing that we're doing a case. I'm seeing them. It's a little bit easier to have conversation. And I also visualize the patients. I know what patients those are. I'm going to go after, if you're in TAVR, it's going to be, valve and valve, small annulus. But I have a patient profile. So whatever device company you work for, think about your most slam dunk case when they want to use your product. And that's what I think about with some other alternatives. And I need to work backwards. So how do I get there? I think about quarter. I need to educate. I need to have therapy awareness. I need to figure out, what their issues are that I need to solve. So what that looks like is, this quarter, I'm not going to do everything in a day or in a week, but I need to have really good conversations, ask a lot of open-ended questions to figure out what their current pain points are. A lot of times reps go in and think it's all about price. So they'll say, oh, my device is 20% less. Or they think it's about the amazing device they have. And they go in and say, my device does this. This is going to help you. A really good rep, and what I'm going to do the first quarter, is ask a lot of questions to understand how I could strategize and tailor my messaging from quarter 2 and 3 to get where I want to be at the year end. I'm also going to think about the resources that I could provide. These amazing companies we work for have so many resources, and it's a little bit overwhelming for you and your customers. And resources could be dinners where they go and learn from peers, other physicians about a specific product. It could be weekends away where they go to a summit with other advanced physicians so they could have a really tailored experience learning, right? A resource could be connecting one-on-one virtually with someone internally at your company or another physician to talk about something, right? There's a lot of resources. So I'm going to think about all the resources I could provide from this quarter to the end and which ones make sense. So I kind of build this customer profile in my mind. So first, a year away, we're 20% market share. They're happy to see me. They're happy to work with me. And then I start thinking about the steps, which it's a little bit hard to do kind of this example because I know a lot about these physicians, but let's just say quarter 1 is finding out what their pain points are and tailoring a solution to solve that problem, and then strategizing quarter 2 and quarter 3 with drop-ins, which are common. We go into the lab and try to talk to them, and more poignant resources, partnerships with senior leadership or internally to help move the needle from 0 to 5% to that 15 to 25%. My goal is 20%, right? And I need to do this plan for every single account. And typically on Fridays when I do this, I think about the long-term strategy and what I need to do to get there, but I also look back and see, has there been any wins or losses, right? Has there been really good results? Has there been any negative results? Have there been potential cases that I need to go after and I need to attack those this week? And that's more of the on the ground level, but I like to think about that last, right? So for example, if they said, I got a text and they're, oh, we're thinking about using you, we want to see you next week for a case, and I don't hear anything, I need to follow up to make sure I lock that case up and that I'm there, right? Or possibly they ask for something. So this will be the last thing I do is think about, okay, they asked for this, how can I get this done? I think one of the biggest things in med device is if you just answer your phone and emails, you're doing about 20-30% of the job, and a lot of people don't do that. There's a lot of else that goes into be a really good rep, but the simplest is just answering your phone, answering emails, and following through with things that you said you're going to do. So another example is, let's imagine a hospital that has partnered historically with my company and me, meaning they do, let's say, 80% market share. Things are really good, but where do I want to be in a year? And you could brush this off and say, well, things are good. Like, what else do we need to do? We have 80% of the market share. So that's not what I recommend. What I recommend is thinking about how can you protect that business? How can you grow the total volume of business to help them treat and help more patients through hospital programs? And that's not practice building. It's not me being a consultant growing this program, but thinking about resources that the physicians in hospital can deploy to help grow the organic volume. Or it's really hard, but if you're, let's say, at 80-85%, can you move the needle and move market share to 90-95%, which I think is probably the most difficult. So in this situation, what I'm thinking about is I want this partnership to continue for the next year, 5 years, and decade. And I also want to help them hit their goals, which are growing the program, being a really robust heart center, right? So I'm going to think about that. I visualize that. They're still happy to see me every single day. And I need to think and work backwards about what we need to do, right? And I don't want to get into maybe specifics, but it could be Perhaps a physician wanted to speak, right, at some big conference. So how can we get him to speak at that big conference? Or perhaps another physician wanted to be involved in research. So how can we partner her with maybe an internal or external source to be involved in that resource? And moving back, it always starts with the clinical value of the product you represent, right? So it always starts there. So how do you make sure that your physicians are really bought in to that messaging? And it's maybe doing lunches or educating on your product, making sure they really understand the therapy. But a really good way to go about getting your physicians really bought in is perhaps you say, hey doc, would you be interested in speaking to other physicians on why you use the device? So she says yes, she's interested. You set up a lunch where she educates on your product, and it's the old saying: what is it? You see one, you teach one, you do one. It helps reinforce why you use a particular product when you educate other people. And then, we work backwards, and we get to the point where I also think, at this busier account, 80% market share, there's going to be more things that need to be taken on the admin level. So thinking about, did I get all my emails sent out to that need to be sent out, right? Was there any requests from this hospital that I have not finished? How can I get those finished so they're on time, right? In these partnered accounts where you're very successful, customer service is the most important thing. So I make sure there's no loose ends, that the to-do list is all marked off. And then we're done. Then we go into the weekend. We attack the next week. We have a strategy about where we need to go, and that's going to set us up for success. So we're not being reactive, we're being proactive, and we're trying to build this bridge to where we want to be. And I think this is what differentiates really good reps from these, legendary reps that, you hear their names of for 5, 10 decades, right? So first, I mentioned this briefly, but just answering your phone, following it through, that's going to set you apart from most sales rep, right? But then how do you go from a reactive to a proactive, right? You're reactive to cases, you're reactive to the sales number, you're reactive to the physician saying something and just having a response to a more calm, proactive role where you're thinking about strategy. You're selling your product, you're partnering with the hospital and physicians to build this partnership where you and they are successful. So this is today's day in the life. I know it's a little bit different than the action-packed days that I usually have, and I don't, I'm not wearing a bouffant or scrubs, but I do think this is a really important part of med device sales, and something that's often overlooked is the internal strategy that you have to think on how to deliver your sales number, right? You're charged with delivering X amount of sales or revenue or unit. So how do we get there for this quarter, and how do we get there sustainably for the next future quarters, right? And if you're able to do this really well, it's going to help you be positioned, like I said, not to be reactive. So when an amazing resource or opportunity internally is presented, you know what customers would buy in and want to do that, right? You don't have to be reactive, and you hear something amazing, a resource from your company, and then you reactively reach out to physicians and no one answers their phone because they're so busy, right? So this is today's episode. We're at it. Good luck breaking in. If you are in, keep up the success. If anyone has any feedback or suggestions or what they're doing to be successful, text me. Let's link up and do a podcast. Take care. This is Medical Device Matt.